Okay, my name is William. I'm gonna do the evaluation. I'm gonna start with past and present and OPQRST, then sample questions. Then after that, I'm gonna go for inspection for swelling, discoloration, and deformity. Then after that, I'm gonna go for bone palpation. In bone palpation, I'm gonna start with the patella. I'm gonna start with the tibia bone, uh, the plateau, the tibulosity, and the shafty all the way down. Then after that, I'm gonna go for femur bone right here, femur bone, the condylus, and the shafty all the way down here. Then after that, I'm gonna go for patella right here, the borders, and the body. Then after that, I'm gonna go for fibular bone right here, the head and the condylus, the head and the shafty. Then after that, I'm gonna check the soft tissue. Now in soft tissue, I'm gonna start with medial. I'm gonna start with medial. I'm gonna start with medial collateral ligament right here. Then I check for lateral collateral ligament here. After that, I'm gonna check for Mansky eye joint, both medial side and the lateral side. Then after that, I'm gonna check for patellar tendon right here. Then after that, I'm gonna check for popliteal fossa at the back of the knee. Then after that, I'm gonna check the quadriceps. In quadriceps, I'm gonna check the rectus femoris right here, the vastus medialis right here, then the vastus lecturalis right here at the side of the knee. So after that, I'm gonna check for Pensasolini group, the sartorius here, the gracilis right here, then the semitendonitis beside you right here. Then after that, I'm gonna check for hamstring at the back of the knee, the biceps, the bicep femoris, then semitendonitis, and then semimembranosis right here at the back, the muscle. Then after that, I'm gonna go for iliotibial band right here, all the way from the hip, all the way down here. Then after soft tissue, I'm gonna do range of motion. I'm gonna have her flex. I'm gonna do range of motion actively. So I'm gonna have her to put her knee in flexion. That's 135 degrees. Then knee external rotation, 10 degrees. Then internal rotation, 10 degrees. Then knee extension, 0 degrees. Then after that, I'm gonna check for muscle action. I'm gonna do resistance range of motion. I'm gonna have her to put her knee in flexion. Then I'm checking for hamstring, bicep femoris, semitendonitis and semimembranosis. Then after that, I'm gonna have her to put her knee in extension, knee extension. Then I'm checking for rectus femoris, vastus medialis, and then vastus lecturalis. Then after that, I'm gonna check for neurological. Then neurological, I'm gonna go for L2 and L4, knee extension like pull and adduction. I'm gonna have you to do your knee like this. So after that, I'm gonna go for L4. That is ankle dorsiflexion and inversion. Put your ankle like this, pull, then in dorsiflexion and knee inversion. Okay, then that's L4, then L5. I'm gonna go for L5. That is toe extension. Like you can play with your toys like this. Yeah, good. Then after that, I'm gonna check for L5 and S1. That is L5 and S1. That is knee flexion, like boop. Good. Then after that, I'm gonna check for S1, that is ankle eversion. Put your ankle like poop in eversion, yeah, perfect, like that. Then after that, I'm gonna check for S1 and S2, that is ankle plantar flexion. Point to me like this. This is ankle plantar flexion. Good. Then after that, I'm gonna check for sensory. Now in sensory, I'm gonna start with S1, the lateral lower foot all the way down here. Then I'm gonna check for S2, the posterior knee at the back of the knee. Then after that, I'm gonna check for L3, the medial knee, L4, the lower medial knee, L5, the posterior, L5, the interior lower leg all the way here. That's L5 right here. Then after that, I'm gonna check for leg flexion. I'm gonna check for two things. The patellar tendon here, I'm gonna check it here like this. Then the Achilles tendon down here like boom. Then after that, I'm gonna check for blood flow. Recapillarization. I'm gonna tap in right here. I have to make sure that the blood comes in 1 to 2 seconds. Then the pulse at the back of the fossa right here. Then I'm gonna compare bilateral. Thank you.